recording. Yeah, I pause at a lot of time when I'm here waiting for everybody. Um, so I got an idea in chat. Those of you who just joined, you can add to it as well. I asked when everybody's taking the exam, and I got July, October, and next April. So if you want to add, when you're taking it. The other thing is, I was just asking people, like, why are they here tonight? What do they want to hear the most about? And it sounds like it's not so much about the actual exam and format and what's on it, but more about the study plan and test taking tips and how the best way to study and get all this material in. So yeah. All right. So it is 7 o'clock. All right. So I don't know how many of you have been on our online office hours before, but welcome if you've not been on. I do quite a few of them. And so hopefully you've been on with me before, or you'll come in on again to hear me do another topic. Tonight, I do a little bit more talking than normal. So usually when I do online office hours on content, I'm giving you content, but I'm having you do polling, and we're doing chat, and you're giving me answers, and you're that kind of thing. But tonight it really is more of me just kind of giving you the information. But again, don't hesitate to ask a question or stop me if I'm going too fast or something. All right, so here's what I've got for our agenda tonight is talking about the format, the content outline, and the format of the exam, but also the questions. Sounds like not a lot of people are here to hear that. So I'm going to go through that kind of quickly. And then what we're going to do is spend a little bit more time talking about that study plan. And let's see, how many weeks are there to the July exam? I'm going to turn off that doorbell too. Who knows? How many weeks before that July exam? Turned off that doorbell. Because those you taking in July know. 8, 10. Okay, perfect. Okay, so you've got time. Yep. And so if you don't have a study plan, you do have time to write one and start it. So that's good. Then we'll talk about how do you study? Like once you have that study plan, like what do you do? Right? There's so much information and what resources are there and how do you do all this? And then we'll talk a little bit about when you're actually on the exam. What are some test taking tips? How do you prioritize what might be the best answer? What do you do if you go back and you feel like you need to change an answer? Do you change it? Do you not? We'll talk about that. Talk a little bit about analyzing your practice exam results. So hopefully you've taken a practice exam or you're planning to, and how do you analyze those results? And then we'll finish a little bit with managing anxiety, but I'm just going to give you a little bit of that. So let's spend more of the time in the middle here. Okay, so content. You know that it's changed. In 2024, it changed. January was the first new version of the exam. There are now 225 questions instead of 250. Only 180 you're being scored on. You won't know which ones you're being scored on and which 45 are test items that you're not being scored on. Because if you knew that, you would just skip them, right? So you're not going to know. But 45 questions are there for them to run stats on to see if they're good items to put on an exam in the future. Okay, so you're going to do 225 questions. You have 5 hours. Okay, that hasn't changed. The way it's set up is you have 5 sections of 45 questions. So you're going to get 45 questions. You're going to answer the questions. You can mark them for review. You can go back to questions. You can go forward in questions. But at some point, you have to say, okay, I'm done with these 45. And you're going to lock those in. And then the next set of 45 questions come up. Okay. And then, so you have 5 sections of 45 questions, 5 hours. So basically you have 1 hour for every 45 questions. Okay. Now you can go faster than that. There are fast test takers, and you'll be getting through 45 questions in 45 minutes. That's fine. But you want to make sure you don't go any slower than 45 questions an hour, because what will happen is when you get to the last set of questions, you won't have as much time, and you're going to then get anxious and you're going to start rushing. Okay, so as you're doing practice exams, try and stick to that 45 question per hour pace. There is a 15-minute break after the second set of questions or after question 90. That is the only time in which the clock on your computer will stop. Okay, we highly suggest you take that 15-minute break. Okay, don't be like, oh, I just want to get this done, I'm just going to plow through. No, don't do that. Take the break. Okay, you can walk out of the testing room into the lobby. You can go to the restroom, you can get something to eat out of your locker, you can get something to drink. Take that 15 minutes to kind of wake yourself up, and then you have to go back in for the next 3 sets of 45 questions. This is a new change for 2024. There are up to 40 questions on scenario-based questions. So not 40 scenarios, 40 questions based on scenarios. So each scenario will have 2 to 5 questions related to it, okay? New content that's been added. They have added the impact of regenerative medicine on PT diagnosis and treatment for musculoskeletal and neuro. So that's like using stem cells for things. So that is new on the exam. Telehealth is new on the exam, not state laws and rules, but just the concept of telehealth and some of the overriding principles of telehealth. Interpretation of electrodiagnostic test summaries. So if they give you the summary of a nerve conduction velocity test, do you understand what that means? Okay. Gross motor development progression. Now that one blows me away. And the reason being is I'm a pediatric therapist and I've been telling people for years they need to know the developmental sequence to take the exam. So when they said they added it, I'm like, what do you mean you added it? Wasn't it always on there? But now you know it's on there. Okay. And then they've also added negative pressure wound therapy and a vacuum cystic closure for wounds. Okay. I think that's really going to be the general principles of it, or why we would use it, or when we would use it. Maybe some contraindications, but I don't think they're going to get into the nitty-gritty like parameters for it. Okay. What have they taken off? They took off phonophoresis. Woohoo! Okay, big deal. But yes, they took that off. The other big change for 2024 is videos. There are going to be questions that have videos. We don't know how many. Okay, I don't think there's going to be a ton, especially because this is new. But you're going to have some videos. You will also have questions that have pictures, and that's been on the exam for years. Okay, and again, I can't tell you how many questions you'll have with pictures, but it's good just to know that it's going to happen and suspect it, anticipate it. Okay, so videos. They suggest when you get to a video question that you go to the bottom right-hand corner of the video and hit the loop button. So the video plays over and over and over again as you're reading the question and you're reading the answers, and you don't have to keep hitting play, okay? The videos can be slowed down and they can be paused. They said on average right now, the videos are about 9 seconds. And you do not need sound. It's all visual. Okay, so in the chat right now, tell me, what kind of questions do you think you're going to see with videos related? Gait, absolutely. So as you are studying and you're like, gosh, what does that glute max lurch look like? Go online and find a video of it, okay? Know what it looks like. Special tests, yes. They're going to show you somebody doing a special test, and they're going to ask you, what are they testing? Okay, so if you're reading about a special test and you're like, gosh, I don't know how to do that, McMurray's. Okay, hopefully you do. But if you say, gosh, I don't know how to do that, what would that look like? Go look for a video. Reflexes, yes. I just gave an exam to my students last semester, and I had video clips of primitive reflexes. And I said, what are you seeing? Or what will this reflex interfere with? Auscultation could be, but no sound. So there won't be any sound. Yeah, any psychomotor skills. The other big one is Therex. So they're going to show you somebody doing Therex, and they're going to say an exercise, and they're going to say, what is this exercise strengthening? Or what part of the gait cycle will this exercise be helpful in improving? Yes. Wounds, that will probably just be a picture, not so much a video, but yes, there are pictures of wounds. All right, good. So that's good to think about, because as you're studying, you kind of want to say, gosh, this could be a good video. Do I know what this would look like? If not, let me go look it up. Let me go find a video on YouTube. Okay. Just real quick, this is the content outline. Biggest part, musculoskeletal. Second biggest, neuro. I do have students that tell me, hey, I'm weak in everything. I don't know where to start my study plan. And I'm like, well, I don't believe you. I don't believe you're weak in everything, but okay. If you think you are and you don't know where to start with musculoskeletal, then go to neuro. If you study that, can you see you've already studied over 50% of the exam? Okay, so if those are weaknesses, or you feel like you're a weakness in everything, that's your priority. Okay, but if you're really good with musculoskeletal, you're like, I rock at musculoskeletal, that's my strength, then put that at towards the end of your, maybe not completely at the end, but towards the end of your study plan. Move up something else that's a weakness. Maybe it's cardiopulmonary, that's 14%. Okay, lymphatics is small, so you shouldn't spend a lot of time there. It's probably not the first thing that should be on your study plan. Other systems, that's pretty big, 17%. So if you're like, okay, I'm not very good with GI, GU, metabolic, endocrine, systems interactions, integumentary, those are things, they make up 17% altogether. And then everything that's outside the body, that's not a body system, like documentation, professional roles, modalities, equipment, that all falls in non-systems. Research, that all falls in non-systems, and that's 14%. Okay, examination is almost 25%. But look at the biggest part, evaluation, differential diagnosis, and prognosis. That's the biggest part. Okay, so again, when it comes to priorities, especially if that's a weakness, that's where you need to spend some time. Intervention, those like almost 30%. Okay, and then smaller parts are those equipment, devices, modalities, safety, professional roles in your research. Okay, so they give you all of this. If you don't have the PT, or I'm sorry, if you don't have the NPT candidate handbook, you can get it right off the FSBPT website. You can download it or print it out. The NPTE candidate handbook. All of this information is in there, along with some other really good information. One of the things I always tell my students to look at in the NPTE candidate handbook is the list of approved abbreviations. There's only 50 approved abbreviations. And when you look at them, you'll say, yeah, I know these. Okay. But I want to make sure you know them. But also, it should relieve some of your fears about them putting abbreviations on the exam that you don't know. Okay. They limit the abbreviations because they don't want to test you on abbreviations. They want to test you on your knowledge. Okay. So anyway, this is in the candidate handbook as well. So you can see musculoskeletals, 27%. You're going to have about 16 in exam, 16 in differential diagnosis, 17 in intervention, about 49 questions. Okay. Why is this important to know? Because your study plan should be very closely resemble the content outline. I make all my students write study plans. I had a student once that said, okay, I'm going to study musculoskeletal for a week. And then I'm going to do neuro for a week. And then I'm going to do cardiopulmonary for a week. And then I'm going to do lymphatics for a week. And I'm like, wait a minute. Why would you spend a week on lymphatics for 6 questions? You should be spending 2 weeks on musculoskeletal and 1 day on lymphatics. Okay, that's why this is important to know. Make sure your study plan, it doesn't have to be exact, but make sure it closely resembles the content outline. Okay. This is the other systems, that's 17%, integumentary, metabolic, endocrine, GI, GU, systems interactions, okay? Metabolic and endocrine, your focus should be diabetes. Yeah, there's other stuff to know, but the focus should be diabetes. And you can see there's not actually any PT exam questions. They're all evaluation, differential diagnosis, prognosis, and intervention, okay? Systems interactions. What is systems interactions? It's any pathology, condition, or treatment that affects multiple systems. All right, what's a pathology that affects multiple systems? Diabetes, cancer, obesity. Well, that's a condition, right? Other conditions that affect multiple systems, pregnancy, FND, depression, bipolar, schizophrenia. What are treatments that affect multiple systems? Aquatics. Okay, so they want to see, do you understand that? You can see there are no PT exam questions. There are no PT intervention questions. They're all evaluation and differential diagnosis. So for example, they're going to give you a question and say, hey, this patient has diabetes and they're presenting with this, this, and this. What are you going to do? And you have to decide, is that part of diabetes or is it not? And should I do something else here? Yeah, rheumatoid arthritis. No, yeah, there's lots. So if you buy our review book, we have a chapter on system interactions, and that's where we have all the psychological, psychiatric stuff. It's where we have the cancer stuff. It's where we have the pregnancy. So we have a chapter on systems interactions. But anytime you're studying and you're like, oh, this pathology doesn't just affect the nervous system. It also affects, whatever. It's fair game for the systems interactions questions. All right, equipment, devices, technologies, 6 questions. You could spend a huge amount of time just on prosthetics. We're not going to do that. We're going to budget our time, only 6 questions. I always tell people the beauty of review books is that it guides you so that you don't go down rabbit holes and you stick to the most important things, especially in these areas where there's not that many questions, but it's kind of a big topic. The review books help you stay on target with what you need to do. Modalities, 5 questions. Okay, so I'm sure, people have forgotten some modality stuff, right? And people are like, okay, do I remember all my precautions and contraindications? And do I remember all my parameters? And you want to study it, but remember, you only have 5 questions here. Musculoskeletal is 50, modalities is 5. So I'm going to study it, but I got to watch and make sure that I'm not spending too much time in that area. There's 6 questions on safety and protection. CPR, they do have CPR and choking on the exam, and first aid. But there's also things like universal precautions, standard precautions, lines and tubes, body mechanics. That would be all in that area. Professional responsibilities, 4 questions. It's primarily, what's the difference between a PT and a PTA? Okay, not state laws and rules, but what are the general differences between the two? Do you know your role? Do you know what the PTA's role is? Okay, and then research, 4 questions. All right, so I have people that say, oh, research, that's a weakness of mine. I'm going to spend a lot of time there. I'm like, no, you're not. For 4 questions, we're going to study it, but we're not going to spend a lot of time there. Again, use the review book. Really guide your studying so you don't go down too big of rabbit holes. All right, just other format things real quick. All questions have 4 answer choices. They won't have 3, they won't have 5. They all have 4. They do not use all the above, none of the above, A and B and C. Nope. All 4 are discrete individual answers, which is a good thing. Answers will all be plausible. They will not make up something that does not exist. So don't read a question and say, well, I've never heard of that special test before. They must have made that up. No, they won't make up anything that's not for real, okay? Now on the exam, if you don't know what it is, I wouldn't pick it. The only way I would pick that answer is if I know the other three are absolutely wrong. But while you're studying for the exam and you're taking practice tests and you see something that you haven't heard of before, I would look it up and see, okay, what is this? Okay, maybe it's just something you didn't hear about in your program. Okay, they will bold and capitalize a keyword like best, first, most appropriate, least likely. So again, they're not trying to trick you. They want you to see those words, but they're not going to bold and capitalize all keywords. There's a cross out feature. You can cross out the answers you know are incorrect. That's nice. There's a highlighting feature. You can highlight keywords. That's nice. Again, minimal abbreviations. Okay, this is important. So I'm going to take a breath here and talk a little bit about this. When you are reading a standalone multiple choice question, all the information in that question is important, okay? Item writers are told, do not add an age, a gender, a time frame, a setting, unless it matters. They are told not to put in extraneous garbage that may confuse you, okay? So when you are reading standalone multiple choice questions and you see that they gave you an age, you should, that's a keyword, stop. Why did they tell me they were 16? Okay, why did they tell me it was home care? That matters, okay? So pay attention to those things. But now they've added scenarios. When you get to the scenario questions, they give you a lot of information. It's like a mini chart review. Now they're asking you to decide what information is relevant and what information is irrelevant to answering the question. So now with the scenarios, the age may not matter. The setting may not matter. The drug that they're on may not matter, okay? So in the scenarios, read it all, take it in, try and decide what's relevant. Standalone multiple choice questions, everything's relevant, okay? Real important thing to know. There are different levels of complexity, so we don't need to talk a lot about that. When you take practice exams, and if you have questions later today about practice exams, we can talk about it. You want to make sure you're taking a practice exam that does have different levels of complexity. You don't want to take a practice exam where they're just constantly asking you to spit back facts, because that is not what the NPTE is going to be like. A lot of the questions, you're going to have to know the fact, but you're going to have to apply it to a particular situation, or it's going to be a high level question where you have to know multiple facts to figure out how to put them together to answer the question, okay? If you have not done the NPTE mini exam, please do it. You can just search FSBPT mini exam, it'll come up. There is a mini exam for PTA and PT, take them both, why not? There is a, when you sign on right below, you'll see they have a key to tell you all the right answers, so you can get yourself a score too. But there's a couple different videos. I want to say there's like 2 or 3 video questions, and there's 2 scenarios. So I think it's just good to get on and see a little mini exam. Also, it begins with the tutorial that you'll have on the day of the test. So I think it's good, like a couple months ahead of time, to take that tutorial. Oh, this is how I'm going to cross out answers. Oh, this is how to use the highlighting feature. Oh, and that way on the day of the exam, when maybe you're not taking in information that's great right at the beginning, you don't have to worry about concentrating on that tutorial. So do it before the test day. And then, yeah, the answers are on the homepage, because I know once you take the mini exam, you're going to know, did I get that question right? Did I give it wrong? It does not give rationales. No, not the mini exam. No. So if you get a question wrong, you'd have to go figure it out on your own. Yeah. Okay. Any questions about content, or the format of the exam or anything? I went through that quickly because I think people want to spend more time here. Okay. Developing a study plan. All right. Well, we recommend 8 to 12 weeks. 8 weeks is really good if you're not on your clinical and you've got all kinds of time to study. If you are on your clinical, or you're working full-time or something while you're trying to study, you're gonna have to draw it out. You're probably gonna need 12 weeks, okay? Make a list of priorities. What are your strengths? What are your weaknesses? Your study plan should start with your weak areas, okay? Why? If you can get through your weak areas first, and then you can be reviewing them every week, by the time the exam comes, they're not your weaknesses. If you get your weaknesses taken care of first, it helps your anxiety. If you leave your weaknesses to the end, it's going to build your anxiety. Practice tests are meant to evaluate how your weaknesses are coming. If you leave your weaknesses to the end, you don't have any time to evaluate them and if you've improved with practice tests. Okay, what if you're studying and you get to the end of your study plan and you are burning out and you cannot study anymore? You do not want to be in your weaknesses, okay? What if you don't know what your strengths and weaknesses are? Take a practice test. Just take a full practice test and say, okay, this is how I did in musculoskeletal. This is how I did in integumentary. This is how I did in cardiopulm, and start to make up your study plan. Again, if you feel like you're just weak in everything, then go by the content outline. Start with musculoskeletal, then go to neuro, then go to cardiopulm, and just work your way down. Okay. We're gonna get back to that knowledge check and stuff. Full practice exams, we said, oh, well, I guess I can talk about the knowledge check. Okay, so we put it in here because we do have an app. So if you didn't buy our book and you don't have our 3 exams, you might want to buy the app. The app is set up to do knowledge checks. So what you can do is you can say, okay, for 2 weeks, I'm going to study musculoskeletal. And then every few days, I'm going to go onto the app and I'm going to take 20 questions on musculoskeletal. Okay, and you can just do those formative knowledge checks as you go. Okay. And then you do want to take full practice exams though, and we recommend 3 to 4. Okay. The PETs are the best. Okay. The retired PET is the best. I see that question. Yes. So if your program bought you 2 PETs, you have a retired one and you have a practice one. That's great. If your program did not buy them for you, you can buy 2 student PETs on your FSBPT profile. The retired one is the real deal. It was used for licensure not long ago. All the questions have been validated. That is the best one. Typically, I tell people to leave that one towards the end, okay? Because that's really going to give you a good sense of, are you ready? How do you adjust that last minute studying, okay? If the program bought you 2 PETs, you can buy 2 PETs. They're completely different. So you could have 4, okay? The app's amazing. Great. Thank you. We've been working really hard on it. I don't know if 100%, but the majority of our questions now are different than our 3 full exams. So good. Weekly review. Have to have a weekly review. We'll talk about that. Study group. It is preferable, just from the research we know about learning, that you study in groups. And I know there are people that don't like it. Okay, and we'll talk a little bit about it, but it is preferable. If you do not have a study group right now, I tell people, come on to online office hours. Put something in the chat. See if somebody else is looking for a study partner. Hook up that way. And then, exchange emails and then work together. Get on Zoom and work together and study in a group. We do want you to get through all the content. We want you to complete both review books, okay? But again, if you leave your strengths to the end and you run out of time, take a deep breath and say, okay, but that's my strength, okay? we do want you to make your plan individualized for you, your study plan. But if you're going to collaborate with other people, you could sit down and say, hey, the three of us are going to study together. Let's put a study plan together. So we're all studying the same things at the same time and taking the same tests at the same time. That'll really help. And that's really awesome. Just make sure you consider everybody's strengths and weaknesses while you're doing that. Okay, we have surveyed students after they've taken our course and they've taken the exam, and we've asked if you're willing to share, did you pass or did you not? And if you passed, how much did you study? And what we found is the average student who has passed has told us they've studied 3 hours a day, 6 days a week for 6 weeks. The average student who has passed studied 3 hours a day, 6 days a week for 6 weeks. That's 108 hours. So what I tell people is make sure your study plan has at least 108 hours. That doesn't include practice exams and review of exams. That's just getting through the review books and doing your studying, okay? So that gives you a good guide. Study by topic, okay? If you're gonna study wound care dressings, study it and finish it before you move on. If you keep jumping around and you never fully finish anything, you will build your anxiety because you will feel like you're not finishing anything, okay? You don't have to do all of musculoskeletal at once, though. For me, that would be agony. I am not a musculoskeletal person. If you said, oh, for the next 3 weeks, you have to study musculoskeletal, I'd be like, right? But musculoskeletal is the biggest part of the exam, so I want to get through that chapter. But maybe I'm just going to take the first 10 pages. And then I'm going to go study something else. And I'm going to come back and do the next 10 pages. Or maybe I'm going to study the knee. And then I'm going to go study something else and then come back. So you don't need to do everything, every chapter, every content area in one big lump. Okay. So decide what's going to work for you. Integrate sources. Review books are great. Use your textbooks. Classmates. Your faculty want you to pass. Use us here at Therapy Ed. Okay. If we're doing an online office hour, if I've got an online office hour coming up about lymphatics and you just studied lymphatics and you have questions, come on online office hours, ask the question. That's what we're here for, okay? You want to take practice tests for diagnostic purposes. How am I doing? Am I getting better? Okay? Don't take exam after exam after exam as a way to study, because it's not a good way to study. Every exam is different, okay? If you're going to take a practice exam, simulate like it's the actual thing. Go to the library where it's quiet. Sit there for 4 to 5 hours. Take that 15-minute break after section 2. Like simulate it like the actual NPTE. Make sure you review your practice exams. I always tell people, yeah, you want to look at what you got wrong. Well, for sure. But I tell people, if you have the time, review the questions you got right as well. Why? Because sometimes you were guessing and you got it right. Okay. But when you read the rationale, was that your rationale? If not, then you've got something to learn. If it was, then it solidifies your knowledge base. Now that content comes up again on another practice test or the NPTE, you won't feel like you're guessing and you're going to feel very confident. It's going to help with your anxiety. All right. This is a study plan Therapy Ed does. I'll go through this one really quick and then I'll show you mine. They say start with a weak area or a large area, like musculoskeletal or neuro or something. Study for a week and a half and take a practice exam. Okay. See, where am I? Okay. Continue. Okay. Pick another weak area or another large area. Take another practice exam. Okay. Now, do you need to refine your study plan? Did you finish all the musculoskeletal and you're good? Okay, good. Or maybe you finished all the cardiopulm, but you're still not doing well. Okay, maybe I need to find time to do a little bit more cardiopulm. Okay, be flexible. Okay. Continue another week. Take a third one. Remaining week. Last one, make some plans for final studying. Take the exam. Okay, gives you about 5 to 7 days for final studying. I had a hard time putting 108 hours in 4 exams in 6 weeks. So my plan is not 6 weeks. Mine is 8 weeks. And then I have another one that's 12 weeks for people when they're on their clinical. So I'm going to go to that here in a minute. I do want to say something about the practice exams though. I have a lot of students who email me and they'll say something like, oh my gosh, I have, 5 weeks left and I took a practice test and I still didn't pass. Okay. Are you done studying? Have you made it through all the content and through both books? No. Okay. What have you studied? Well, I've studied cardiopulm. Did you pass cardiopulm? Yes. Okay. So I'm like, let's concentrate on the stuff we've studied in those scores. And are those scores going up? Let's not get really upset about the content we're not passing yet, but we haven't even gotten to it in our study plan yet. Okay, let's wait till we get to it in our study plan, and then let's make sure that we're getting passing scores. Okay, I hope that makes sense. I think some people concentrate on the stuff they're not passing or the total score when they're not realizing the stuff they've studied, they are passing or their scores are going up, or maybe they haven't passed yet, but their overall score is going up. So to me, you're on the right track. Okay, and so I don't mind talking to people about that. All right, here's my 8-week plan. 27% of this is musculoskeletal, 25 is neuro, 14% is cardiopulm. This is based on the content outline. This is also based on the 108 hours that students have told us they need to study. So basically all I did was say, okay, if musculoskeletal is like 28%, what's 28% of 108 hours? It's 30 hours, okay? That's how I came up with this. Musculoskeletal might be your strength, so move musculoskeletal to the end then, okay? It doesn't have to be first. You could follow this study plan exactly as it's written. The reason I put musculoskeletal first is it's the biggest part of the exam, and then neuro, and then so it's organized based on the content outline as well. Okay, it doesn't include all the pages in the therapy ed book, so review those other pages of time. So yes, so here's the thing. This one is an old one. not old, the page numbers are old. So every year we come out with a new review and study guide. So the page numbers that say SG, that's our big review book. Every year when that book comes out, I have to update the page numbers. The course manual just was revised. So I've just revised those as well. So I will give you guys my email. Actually, I'll put it in chat right now. If you want this updated study plan with the new books, with the right page numbers, email me and I'll send it to you, okay? The course manual, that small book, if you've taken our 2-day course, the very beginning of it, like the first 100 pages, are all foundational review. That's not on here. That I usually tell people, do that right before you start your 8-week study plan. Okay. So things to point out. I've got 4 practice exams in here. I've got a day for you to review them. Do you see on Saturday, I have a review. Okay. Research, and I'm going to talk about this later, but research shows reading and rereading does not help learning. What helps learning is constant quizzing and questioning. So I'll just talk about it now. This is the way I recommend that you study. Take the review books, okay? Go through the chapters. If there's something you read and you know it, leave it in the book. Somebody said there's too much information, right? If you know it, leave it in the book. If you read something and you say, okay, yeah, I do know that, but I think I'm afraid I'll forget it, highlight it in the book. Then when you get to something and you say to yourself, yeah, I don't know this I really struggle with. I struggled with it in school. I really don't understand it. That you pull out and put onto a study guide. Okay. I have people who have written study guides where they've basically rewritten the whole review book. That is a waste of your time. Do not do it. You know it, leave it in the book. You know it, but you're afraid you're going to forget it, highlight it. You're really struggling with it, pull it out, put it on a study guide. All right, then this is what you do on those review days. You hand those review books to somebody and you say, everything that's highlighted, quiz me on it. Quiz me on it. I want that repetition. I got to remember it. Okay. The more you quiz on it, the more you'll know it, the more you'll remember it. Then take those study guides. That's the content you're going to dive into. That's what you take to your study group. Explain this to me. I don't understand this. Okay. Those are the concepts you're going to spend a little bit more time on to try and get to understand. Okay. So that's kind of how I tell people to go about it. Now, if you're on clinical, 8-week one doesn't work for you because you can't do 3 hours after you get home from the clinic at night. No way. So basically you're doing a lot on Saturday and Sunday. Okay. And you're only doing like 1 hour a day, Monday through Friday. Okay. And again, I just updated this. So if you want it, just email it to me because I put all the practice exams now on the weekends because I'm like, they can't take a practice exam on a Thursday night when they get home from the clinic. That's another 4 or 5 hours. So I have redone this one a bit and I've updated all the page numbers. Okay. All right. So have a study plan. Okay. Develop a study plan. It doesn't have to take you long to do it. It will actually help your anxiety. If some people will get a hold of me. I'm getting really nervous. The exam's coming. Okay. Do you have a study plan? Yes. Are you on track? Yes. Okay. Then that should help. I want you to go to the testing center the day of the exam, and I want you to say, I did it. I made it through that study plan. I made it through my review books. I'm ready. Okay. It will actually help your anxiety. So you can take my study plans, cut them apart, put them back together, put them on a calendar, put them on an Excel spreadsheet, whatever. Okay. To make it work for you. Mark off days you can't study. Okay. Figure out the days you can. Get in those 108 hours. How am I going to do that? Some of you are probably working 4-day clinicals. You have Friday, Saturday, and Sunday off. Okay, then redo my plan so it fits for you. Okay. Okay. When will your group studying occur? You need to be thinking about that. Okay. That's very, very helpful. All right, let's see. Do I have anything else about study plan? No. So what questions do you have about study plan? Is that helpful? I hope. All right, we already just started to go over some of this, but let's look at best practices. Yeah, know the goal. Okay, my goal tonight in the 3 hours I have is to get through these 15 pages in the review book. That's my goal. My goal tonight is I'm going to get through primitive reflexes tonight. Have that goal, okay? Use that review book. Stick to entry level. Again, constant quizzing, questioning. We already talked about this. Highlighting material. Study guides or flashcards, but don't rewrite the book. Make sure that when you're studying, you get to all types of critical reasoning. So analytical questions are the questions on the exam where they're going to give you all these signs and symptoms and ask you what pathology is most likely. Okay. Some people struggle with those. So if you struggle with those, think about, well, where? Is it the cardiac pathologies you struggle with? Then make a table. Here's all the common cardiac pathologies. These are the signs and symptoms. These are the lab values. These are the ECGs. You have to study the pieces of the puzzle so that you can get those questions right. When you're studying, always be thinking about, okay, I just studied this very specific thing. Okay, I just studied that this would be a great PNF special technique and pattern to use with somebody who's had a stroke with a hemiplegic shoulder. That's very specific. But stop and ask yourself, who else would I do this with? Who would I not do it with? Why? That gets to inductive reasoning. Deductive. Let's say you learned something very vague or general. Oh, I just read the principles of aquatics. Great. Stop and think, okay, Who would aquatics be perfect for? What patient would I do this for? Okay, so inductive and deductive is going from specific to general and general to specific. So just always be asking yourself questions. Inferential reasoning. These are the types of questions where you read the question and you're like, how am I going to answer that? They didn't give me enough information. How can I? They just said they had a brain injury. They didn't give me Rancho levels. How am I supposed to come up with an answer? It's probably an inferential reasoning question, because what they're trying to do is they want you to imagine what the typical person looks like. And based on your knowledge, can you come up with what's probably the best answer? So for example, if I say, okay, you had a patient came in today and they've been recently diagnosed with multiple sclerosis, which of the following treatment plans would be the best, or treatment approaches would be the best to include in their plan of care? Okay, I don't have to tell you, I shouldn't have to tell you that people with MS, their biggest issue is fatigue. You should know that. And so hopefully you pick the answer that says you should do energy conservation techniques with that person. Okay, that's an example of inferential reasoning. Somebody will say to me, but Suzanne, you don't know that it didn't say they had fatigue. No, but I know that they do. I know that it's very likely that they do because I know something about MS. Okay, so when you're studying, always stop back and say, what does the typical person look like? How would the typical person with a brain injury present? What would a typical person with congestive heart failure, how would they present? That'll help you answer these questions. Evaluative, I think most students do good on these. These are ethical decision-making questions. They're, they give you some kind of dilemma and you have to read and decide what's best to do. So if people do struggle here, I'm like, go back to your ethical decision-making principles and things like that. Group studying is very valuable. Why? Well, we know groups have more knowledge than one person. Groups stimulate creativity and problem solving. Students retain more information when they group study. They come away with a deeper knowledge. Remember, the exam is not just spitting back the facts. You have to understand it and apply it. Groups help you do that. And you'll feel overall satisfaction and supported. The ideal group size is 3 to 5. If you have 6 people in your group, I always tell people don't vote somebody off the island. But if they get too big, it's not going to work too well. But if your group only has 2 people, maybe look for another. A lot of students tell me they don't like to group study. One, it increases their anxiety. I'm like, okay, agree with your group what you're going to study. We're all going to get together on Saturday and we are going to study ECG strips. Study it on your own first. Go prepared. Actually, then you probably won't have a lot of anxiety. Actually, it'll probably help your anxiety. And you may actually then be able to teach the group some things. Okay. If you don't have a good study group, find another one. The other, I don't need to say that, like flip it and like get rid of all your friends. That's not what I'm saying, but you got to do what's best for you, right? So if you don't have a good study group, maybe find somebody to add to it or spend some of your time with different groups. The other reason people don't like to study in groups is because they say it's not time efficient. Okay, well, that's because your group has not agreed with how to spend your time. So I like this Pomodoro technique. Agree, okay, for 25 minutes, we are going to study primitive reflexes. When the timer goes off, we get a 5 or 10 minute break. We'll go get coffee and go to the bathroom, and then we'll talk about what movie we're going to see this weekend. But during the 25 minutes, the only thing we talk about is primitive reflexes. Okay, when the timer goes off after our break, we have another 25 minutes. We're back at it. Okay, if your group can agree to that, they will be efficient. And actually, think about it. Have you ever been studying and you read something and you're like, I don't understand that. I wonder why that is. And you go looking for the answer and you find it an hour later. Isn't it more efficient if you ask your group and they're like, oh yeah, I understand that, and they tell you? That's more efficient. Okay, so think about that. Okay, group studying is very beneficial. Ask lots of questions. Have them ask you a lot of questions. All right, test taking tips. Obviously, you want to read the whole question. Remember, missing one word in that single multiple choice question can get you on the wrong path. Oh, I didn't see they were in home care, right? And that matters. Read the whole thing. What are they asking you? That sounds easy, but I've read questions and I get into the answers and I'm thinking about the answer and I forgot that they asked me which of the following was least likely. Okay, so a lot of times I'm like, what is the question? And a lot of times I go, after I read the answers, I go back to make sure I remember what's being asked of me. Identify keywords, use that highlighting feature. Read all the answer choices. Don't pick the first one that just looks good. Got to read them all. Get it down to 2 if you can. Okay. But if you read a question and you're like, oh, I have no idea. And you will see questions like that. And you're going to be like, I have no idea. Don't just pick from 4 answers. You got a 25% chance of getting it right. Instead, use some of the tips I give you today to get it down to 2. It is very likely one of those is the right answer. Now you have a 50-50 chance of getting it right. Okay. If you know it's wrong, cross it out. Get rid of it. Use the cross out feature. Reread. I would read the question. Did I get all the keywords? Is there anything I missed? What is the question asking me? Let me reread the answers. Verify that is the answer that I want. Now, do I want to check it for review and come back to it? Or am I good? Okay, so you have to make that decision. Don't leave any questions unanswered. Okay, follow my thinking. Let's say that I see we only have 9 minutes left. I'm going to keep going. I am going to finish tonight. If you can't hang on, it's being recorded. It'll get on YouTube tomorrow. But let's say you're taking the exam and you get to question 30 and you're like, oh, I don't know. And you leave it blank. Okay. What happens when you get to the end of your 45 questions set? You look at your clock. You took more than an hour and you left 5 blank. You do not want to be in that situation. You need to go back and answer those 5. Your anxiety is going to go up and now you're under a time crunch. No, answer every question as it comes up. If you get to the end of your question block and you're running behind, I want you to stop and say, okay, I didn't leave anything blank though. I did the best I could. I'm moving forward. Okay. If you get to the end of your 45 question block and you're like, oh, wow, I still have another 10 minutes. I can now go back and review some. Then you can do that. Okay. So hopefully that makes sense. Safety. Always be thinking safety first. The reason you're taking this exam is to make sure you're going to be a safe practitioner. Okay. So if you're down to 2 answers and you're not sure which one to pick, I'd be thinking, well, what's the safest thing? Okay. Always go for safety first. Then financial, social, emotional, even functional. Okay, we got to do safety first. Think about what is physiologically best for that patient's body first. The secondary will be dealing with their emotions, their social issue, their function, their financial. Okay, always safety first. Are you the kind of person that adds information to questions when you shouldn't? Well, maybe they have stairs at home. Well, maybe they don't. Maybe they live alone. Maybe they don't. If you're this person, you have to stop yourself and say, wait a minute, could the opposite be equally true? Maybe they have steps at home, but maybe they don't. Either one could be true. Get it out. I got to take it out of there. Okay. That's just extraneous information. But if you say, they have MS, multiple sclerosis, I'm pretty sure they have fatigue. That's different. That's using your reasoning and your knowledge base. Okay. So if you recognize that they're different, do you go back and change answers? We do suggest you mark questions for review. And if you have time, we do suggest you go back and review because sometimes you'll pick up a simple reading error or something. Okay. So if time allows, go back. But be very diligent. If you still don't know, do not change your answer. Don't be a second guesser. It will increase your anxiety, okay? And it's just not a good thing to do. But if you go back and the light bulb goes off, oh my gosh, I missed that keyword. Oh, now I see they're in rehab. Oh, I misread that. You have a really good reason for changing it, change it, okay? So research has been done on this. If you believe, multiple research studies have been done on this. And what they found is you should go back and review. And if you adhere to this, I still don't know, I'm going to leave it alone. Or the light bulb goes off, I'm going to change it. They actually have found that you changed the wrong answer to the right answer by approximately 3 to 1. So you want to go back and check, okay? But be very diligent. Don't just second guess yourself, okay? Are you a slow test taker? Practice with practice tests. Got to get that 45 question per hour pace down. You have 1:30 per question on average. Some questions you'll do quick, some you'll need a little bit more time, but on average, 1:30 per question, right? 45 per hour, work on that. If you are a slow test taker, I do not recommend you use the highlighting feature on every question. It will slow you down. I would use the highlighting feature on just the questions that you're struggling with, that you're marking for review. So when you come back to review it, you don't miss some keywords, okay? Are you a fast test taker? Is that a problem? Maybe, maybe not. How do you know? Okay, take a practice test. Oh my gosh, that was a 200 question test and I just took it in 2 hours. Okay, how do I know if that's a problem or not? When you review your test and you're reviewing the questions you got wrong, if you're saying to yourself, oh my gosh, I missed that. Oh, I didn't see that. Oh, why did I say that? Oh, that was dumb. You're going too fast. Then, if that's the problem, then I recommend you use the highlighting feature on every single question. It makes you slow down. It makes you read every word because you're just trying to decide which ones to highlight, okay? And that'll force you to slow down. Okay. Yes, you want to look at the questions you got wrong. But again, as I said before, if you have time, look at all the questions, okay? When you miss a question, I want you to say why. Why did I miss that question? Was it I didn't know the information? Then you study it. Okay, I got to go study those primitive reflexes because I didn't know that. Is it that you understood the material? You understand it, but you didn't apply it appropriately. Well, why? What did you miss in the question that didn't have you apply it appropriately? Did you miss that they're 86 and they have dementia? Okay, what is it in the question you missed? Are you going too fast? Are you skipping keywords? Okay. Are you going back and changing answers because you're second guessing yourself? Okay. Are you adding that extraneous information? So why is this important? When I sit down with a student and review an exam and they're like, yeah, I didn't know that. Yeah, I didn't know that. I'm like, okay, you just need more study time. You just need to study. Okay. Well, I knew that, but I didn't apply it right. Okay. You're not reading every word. You're missing key words. You're not considering all the pieces of the puzzle or the question. You need to slow down. Okay. I had a student who was always second guessing herself, going back and changing her right answers to wrong answers. And I'm like, are you just second guessing or do you have a good reason? No, I'm just second guessing. Got to stop it. Okay. So learning some of this about yourself will help with your test taking. All right, good. You're going to increase your knowledge base by reviewing the questions, also learning something about your test taking skills. After you take an exam, do I need to adapt my study plan? Am I good? Do I need to change how I'm studying? Is that working okay or not? Do I need to change any of my test taking strategies? Do I need to use that highlighting feature more or what have you? And again, concentrate. Is your total score increasing? Are the scores on the stuff you've already passed, is that increasing? Okay. I highly suggest you log your scores on an Excel spreadsheet. Or you can email me. I gave you my email. I have a sheet that I give students. I think every single time you take a practice exam, you should fill in your scores. Why? Because if you reach out to me and you want help, I'm going to say, I need to see all your scores, and you'd already have it. But here's the other thing. You will feel sometimes like you're all over the place. But if you put your scores side by side, you start to see trends. Oh, this is something I've passed every time. This is something I've never passed. This is something I passed 3 out of 4 times. This is something I only passed 1 out of 4 times. Oh, this is consistently my lowest score. This is consistently my highest score. This score is trending up. Like, there are patterns, okay? And I've met with lots of students to look over their scores and help them with that. So I'm available to people if you need that. What is passing? If you're taking therapy eds exams or a lot of the other companies out there that have practice exams, you're looking for a 70 to 75% correct. But if you're taking the PEATs, you're shooting for a 600. Be careful with looking at the percents, okay? The percent tells me how easy or difficult those questions were. The percent will not tell you if you passed that section. The only thing that tells you if you passed is the scaled score, and you need a 600 or higher. Okay, so here's the thing. I had a student that reached out to me and said, gosh, I thought I knew GI and GU. I did a pelvic health clinical. I thought I knew it. I thought I was going to ace it. Look, I failed that on my practice exam. I got a 65%. And I said, you got a 610. You passed it. All you needed was a 65%. Actually, you could have got some questions wrong and still probably passed it. Those questions were hard, and you got enough right to get over 600. You passed it. Okay. I've had the opposite happen. Look, I got a 72%. I passed. No, you got a 595. Those were easier questions, and you didn't get enough right to hit the 600. Okay. If you need help with your PEAT exam scores, reach out to me and we can talk about it. Because when you get them, you see all these numbers and you're like, what the heck am I looking at? Right? What I would do is look at the top where it says your score and look for the scaled score all the way down and make sure you got a 600 or higher. That tells you if you passed each section or not. Remember, on the actual exam, you don't have to pass each section. You just have to pass the overall exam, okay? Each exam is different. So keep that in mind too. I'll have a student who'll say, well, I took my first PEAT and I got a 590, but then I took my second PEAT and I got a 580. And they're like all like upset about it. And I'm like, okay, yes, you went down. But every exam is different. And you just have to hang in and keep working. Let's look at the things you've studied. Did those things go up? Because over time, your scores are going to come up. Okay. This is an example. This is a student who sent me their results, and I said, okay, the yellow, this 599, you're right there. You're almost passing. The green, you passed all these things. The blue are your lowest scores. You got cardiopulm was your lowest twice. Let's pay attention to cardiopulm. Okay. See if I can find one where they got, oh, so let's look here. Do you see on interventions, they got a 621. That was a 73%. But over here, they got a 73% and was a 651. Now, a student that's just looking at the percents would say, oh, I got the same score. No. On the second time you took it, you got a higher score. You scored 30 points higher. You went from a 621 to a 651. What does that mean? It means the second exam was harder and you did better. Okay, so that's where the percents will kind of trick you up. Okay, look down at the bottom here. They got a 660 on non-systems. That was 68%. So they probably thought, oh, 68%, I failed that. No, you got a 660. Those were hard questions. You didn't need to get 70% correct to get that, past that. Okay, that's why those are tricky. So we're here to help you. All right, managing anxiety really quick. Prior to the exam, finish that study plan. Seek help. If you have test anxiety and you've never got help before, seek it. I tell people, take a test drive to the Prometric Center a couple weeks in advance. You do not want to get lost that day. You want to know where you're going. Park, walk in, talk to the person in the testing center, see where the lockers are, the bathroom is. Believe it or not, your anxiety will be less that day because you know your surroundings and what's going to happen. Focus on what you can accomplish, or what you have accomplished, not what you have left to do. I finished all my musculoskeletal. Yay! Yes, I still have neuro and cardiopulm to do, but I'm going to focus on the fact that I finished musculoskeletal. Okay, that'll help your anxiety. Keep a positive attitude. Reminders, if you need reminders, put sticky notes through your house. Put them through your review book. Day of the exam, arrive early. You don't want to be late. Get there an hour early. Understand there are some things outside of your control. Don't let that get to you. Okay, there's a computer issue. We can't start on time. Not in my control. It's fine. Okay, you're just going to have to talk to yourself. Don't let it affect you. Okay. While you're doing that little, even if you do the mini exam and you do that tutorial, I suggest you still do it on the day of the exam. Okay, because it's just a good time. Your time hasn't started yet. You can just sit there, but it's a good time to do some deep breathing, work on your autonomic nervous system, decrease your heart rate. It's just a great thing to do. When the exam starts, you can write anything down you want. You will have dry erase boards. They usually give you 2 dry erase boards. You cannot write anything until the exam starts, but once it starts, you can write whatever you want down. So some students tell me, if I write my sensitivity and specificity stuff down, I can breathe a sigh of relief because now I know when that question comes, my answer is right there. It decreases my anxiety, okay? But if you're going to do that little brain dump on your dry erase board, 5 minutes max. Do not spend a lot of time because then you'll feel like you're behind. Most people are anxious at the beginning of the test and then they calm down. But then they get to a set of questions that they're struggling with and their anxiety comes back up. So what you need to do is you need to stop and say, okay, I just had 2 or 3 questions in a row. They were tough. Not sure I got those right, but you know what? They were only 3 questions. I did 50 earlier. I believe I did really well. I still have 150 to go. Okay. So you just have to talk to yourself. Maybe stop, take a deep breath. Okay. Don't get yourself, it's hard. It's really, really hard. I know. But that will really throw people. Watch your time. If you get behind, it's going to increase your anxiety. Watch your time. Don't watch it constantly, but every set of 45 questions, did I take an hour or more? Do I need to speed up a little bit? Can I slow down a little bit? Okay. Most people have enough time. Therapy ed resources. We do have a 2-day prep course. If you haven't taken it, we do it in person or online. You can check it out on our website. With that, you will get a course manual. I always say that course manual is a blueprint and outline or your Cliff Notes. We also have the review and study guide. That is the big review book, very comprehensive studying. And with that review and study guide, you get 3 full practice exams. Our practice exams are now 225 questions with scenarios and with videos. The new app, that lets you do sets of questions in any content area whenever you would like to evaluate your knowledge. And then online office hours, here we are. So this is the start of our 9 weeks of online office hours. We start them 9 weeks prior to every exam. And again, they're on YouTube. So you can look at that as well. This is what's upcoming. Next week is neuromuscular pathologies. Then we have spine, clinical practice guidelines, heart failure, practice guidelines. I'll be back with integumentary. We have hip pain. We're going to take off. We didn't think anybody would come July 3rd. Maybe I'm wrong, but we didn't think. And then we have a review of E-stim, electrotherapeutics, and then elbow, wrist, hand, and that's this 9 weeks. If you're taking it in October, we'll start again 9 weeks before the October one, 9 weeks before the January, 9 weeks for the April one. If there's a topic, like I did one on GI pathologies, I did one on lymphedema. Those are on YouTube. So you can't join them live, maybe, but they're on YouTube. All right, there is my email. Please email me if you need anything. And I'm going to stick around for a while. Is the app included with the book? No, it's separate. So the big book comes with 3 full exams, but the app is separate. In regards to what you mentioned about the whiteboard, what kind of questions will be asked? Oh, so I wouldn't concentrate a lot on research because remember, you're only going to have like 3 to 5 questions, but they can say, there's this new test that's come out in the literature, and the sensitivity is 94% and the specificity is 35%. What's the problem with this test? And they want to see if you know what a low specificity means. That's the kind of question they'll give you. Let's see. Okay, yeah, you guys are. How can I subscribe to have all the meetings? These ones, the online office hours, you just come on every Wednesday night. Yeah, for the next, let's see, what are we doing here? We will be on every Wednesday night until July 17th, except for July 3rd. Yeah, so just come on. If you want to listen to the ones that have already been recorded, just go to YouTube and look up Therapy Ed online office hours. Now we do them for OT too, so you'll want to like make sure you're on the PT ones, but there's a link on our website to them all also. Yeah. Oh, thank you. Awesome. Yes. Thank you, Courtney. I have a TED 2020. Should I get a I'm not sure what you're talking about, Eve. Are you talking about TED Talks? I'm not sure. Or are you talking about a review book? You might, review book. Oh, yeah. I gotcha. I should have known that. I'm like thinking TED Talk. Review book. If you have a 2023, that's probably okay. We do update the big book every year. One of the great things we updated in 2024 is we put a pharmacology table in each chapter. And that to me is like, because it's just like, these are the medications we think are most likely to show up. This is what you need to know about them. So that I think is a really good thing. We always update the clinical practice guidelines as they come out, and we think that they're going to be in there. So we do make changes every year. But the 2023, I mean, it was just last year's. So yeah. All right, what else? Are cervical mobilizations on the exam? Yes. Yeah, and so you might want to join June 5th when he's going over the cervical spine. Now, he's going to be going over the clinical practice guidelines, but he's an expert. So if you have questions about cervical mobilizations, precautions, contraindications, how to do them, what direction, Brad can probably help you out. I'm not the person you want to ask, but he could probably help you out. Yes. Know your grades of mobilization. Yep. For your extremities, know your convex concave rule. Yes. Know your precautions, contraindications. Yes, they're on there. What else? I'm gonna go ahead and end the recording.